Hey everybody, welcome back. Would like to do a video today upon request. What do you do when your cast comes off? What should I know about my skin when the cast comes off? Went ahead and made a cast, went ahead and split the cast, and we're gonna go, I have some stuff laid out on the counter here. We're gonna talk about skin care and care of the extremity once the cast comes off, if you wanna follow me this way. When a cast comes off, now first things first, when you have a cast on, it's usually on 4 to 6 weeks. Sometimes longer, sometimes shorter, but if you have a cast on and it's been on for about a month, give or take, when you remove the cast, this is gonna be really gross. It's gonna be full of oil and sweat and dead skin and some hair that would have otherwise fallen off. If it's pediatrics, you might have some other stuff in there, dirt and debris and grass and who knows what else. But what you have to remember is that whatever you see inside the cast is also on the skin. So you have to take a little extra care of the skin for the 1 or 2 days following the cast removal before you just go straight into like normal everyday stuff. So first things first, when the cast comes off, as soon as the cast comes off, if it was a longer cast, if it went all the way to a long arm cast, when the cast comes off, they always want to scratch right here at the AC bend, or if it's a long leg cast, they always want to scratch right here in the popliteal space. They want to really go to town on it. Don't let them do that. Whatever you do, it's going to get red, it's going to get raw, you might even break the skin. Then you're going to have, because you have all this gross dead skin bacteria, you have the chance of breaking the skin and some bacteria getting in there. So what you want to remember when the cast comes off, as soon as the cast comes off, first thing you want to do is you want to offer them some cool wash water, maybe some soap, maybe some gentle soap, regular washing, no scrubbing. Also, when they're drying after the wash, no drying like so, just dab dry, because remember the skin is very sensitive after the cast comes off. The next thing, if for whatever reason they wash or they choose not to wash, they want another option, you can do wipes, standard, regular, safe, skin safe baby wipes, whatever you want to call them, disposable wipes. You can offer a moisturizer. You can also offer a non-medicated cream. Put some cream on it. The one thing you want to emphasize is you just don't want to scratch. You can rub and you can wash and you can wipe, just not scratching, because you're going to break that skin open and you're going to cause secondary problems. Some providers will offer some alcohol to rub it and give it a cooling effect, but alcohol and moisturizer, and we'll talk a little bit about that here in a second. Remember that if you already have pre-existing breaks in the skin, this is going to burn, it's going to be uncomfortable, they're not going to like you very much for that. So I would take it easy with the alcohol, but you would put it on some 4x4s, you just kind of dab it, wherever it's itching and so on and so forth. I have the peroxide laid out here because there will be times when you take a cast off, and sometimes, say you have an abrasion, maybe the stockinette has gotten stuck to the abrasion, or the cotton, or maybe you had I'll show you. Maybe you had a little bandage inside underneath the cast, and now the bandage is stuck to where the abrasion, like it's embedded in what is now probably a scab. So what you would do, some providers will offer patients a little bit of peroxide, or even maybe a half peroxide, half sterile water blend. They'll lay it on there and let it kind of eat away a little bit at the adhesion point where the bandage is with the scab, and it makes it easier to peel it away rather than yank the whole scab off. That's why I have the peroxide laid out. Another thing too, we just want to touch base on before we wrap up the video. If you have, I'll use this, but I'm going to talk about legs for real quick. If you have a cast on, you take the cast off. If you're doing a leg cast and the hair, of course, is grown, say for example you have a young lady or a female or somebody who typically shaves their legs. Well, of course they're gonna have a hairy leg because they haven't shaved their leg in a month. The first thing they're going to want to do is leave your office and go straight home, take a shower, whatever, and shave their legs. You really want to emphasize not shaving your legs for at least 2 to 3 showers. And again, you don't want to go home and make a huge scrub. You don't want to do anything crazy. You want to take a normal shower, a normal bath. You want to exfoliate very, very non-aggressively, and after 1 or 2 showers, maybe 2 or 3 showers, then you can go ahead and shave without the risk of a staph infection from that bacteria going inside the hair follicles. So I think that covers everything, guys. Gentle care. Oh, last thing, almost forgot. If it's hot outside and your skin hasn't been exposed to the sun, remember where that cast was, this is the last point, where that cast was, that whole top layer of skin is going to shed off, and if it's hot outside, that new skin runs the risk of getting sunburned a lot easier. So just remember, if you come out of a cast and it's summertime and you have plans this weekend to go to the pool, you want to put a little extra sunblock on there so you don't get sunburned. So I think we covered all the big things. If you guys have any questions, feel free to reach out. Look forward to some more videos, and you guys take care. Have a good summer.